Hi, welcome to Functional Fridays. I am Dr. Sherry Jacobs, naturopathic doctor, certified nutrition specialist, and I'm with Shannon Kennedy, internal medicine doctor. You put out a video a couple weeks ago, and it was about how to prep and things to have at home medically before, and that you should be tracking before you have a telehealth visit. And I thought that was very informative because it was really nice to just know that there are things you can have around the house and that will give you feedback, and that would be really good in preparation for a physician visit.
Yes, and when we were talking about that, we were talking about how really, in the grand scheme of things, the devices are readily available from the pharmacy and not that expensive, and a really good investment in your overall health when you're trying to keep track of what's going on in your body. So you thought of a few more things that were like we should tell our patients and our friends to keep track of these things so that we can detect underlying disease, but more importantly, prevent underlying disease before it happens.
So one of my favorite things is for people to get a home glucometer to check their blood sugar levels at home, because you really don't know. I mean, how do you know if a food is working well for you or not? I mean, we have books that we can read. We have these ideas of healthy foods and not healthy foods, and certainly we have how we feel. Taking your blood sugar readings gives you a completely different perspective on whether a food is working for you or whether it's not working for you. And so if you're okay pricking your finger, I know it's a little daunting for some people at first, but really once you get used to it, it's a very simple, easy process. And so I like, and this is normally recommended for people that are already diagnosed with diabetes. We're talking about prevention and finding foods that are really working for you, a whole totally different ballgame.
Yes.
We do like to measure fasting glucose in the morning, and that's a very standard time to measure glucose, and that tells you certainly how your body's handling sugars, but more importantly, how your body's handling stress and what kind of sleep you're getting.
Absolutely. Yeah, we see a lot of high blood sugars first thing in the morning, and that's usually when people go get their labs done. Mm-hmm. So we get one blood sugar every 3 to 6 months on a person. It's slightly above 100. And there are more tests we can do to look to see if they are, pre-diabetic or actually diabetic. But what's really helpful is to know, was that high blood sugar in the morning due to stress from driving to LabCorp and sitting in traffic, or was it due to having a restless night of sleep, like obstructive sleep apnea or limb movements, or just not sleeping well because like your progesterone's too low, and you wake up and your body's stressed, and so cortisol's been released and your blood sugar's high. Or is your blood sugar normally good in the morning, but when you eat a really healthy dinner, including like beans, which you think are healthy, and maybe beans, keep your blood sugar high all night, and they're not good for you. For some people, certain foods are touted as healthy, and for other people, their bodies are just not using the sugars properly and creating high blood sugars in the morning. So you can check your blood sugar in the morning and say, wow, that meal I had last night that I thought was healthy, really not so healthy for me.
Yes, and you can also check 1 and 2 hour, what we call postprandial or after meal numbers, to again see how much of a rise you're getting. And you really want, at about the 2 hour mark, you want that blood sugar to come down close to your fasting levels, and that shows you that that was a good meal for you, that meal worked, and so you have to do this in conjunction with a food diary, because otherwise if you just end up with a bunch of numbers at the end of the day, it's not really giving you a good feedback.
Right. And I think just having mindfulness about what you're eating and how your body feels with those foods in your body, if you're actually looking at a number objectively and you're looking at the foods that's been written down, it really helps. And there's 2 types of people in the world. There's people who are like, left brain, and they love the numbers and they love recording stuff. And I think a lot of people, are, that sounds awful. It's very daunting, and they don't want to do that. But at the end of the day, when you do it, it's very empowering for both sides, left brain people, right brain people. It's very empowering, because you're like, 2 hours after I eat whatever kind of meal, I had an anxiety attack, or I feel like I need to take a nap, and look at what my blood sugar's doing. And it's very helpful because it's often related to that.
It is, and absolutely. So many symptoms can be related to not having good glucose control. And so this is an excellent, pretty inexpensive way to monitor and see what kind of glucose control you have and see what foods are working for you. And it doesn't have to be done, in this scenario for prevention. It's not, we're not monitoring diabetes. So it can be done for a period of a couple weeks, and then you can put your glucometer away and forget about it, and you can bring it back out again. So it's not something that we're asking people to do for the next 6 months every day. We're just getting some good feedback in the beginning.
Absolutely. It's a good device to have at home. And insurance won't cover a glucometer unless you have diabetes and a good insurance plan. I hate talking about insurance. It's good to know that they're pretty affordable. I mean, thinking of a device that's going to help you prevent and detect disease for years to come, It's a good investment. You have to buy the glucometer, you have to buy the test strips, and you have to buy the lancets. Those 3 things are all available over the counter at a pharmacy.
Yes, so you don't need a prescription or
You don't
anything
need
for
a
this.
prescription.
So, doing that in conjunction with a good food diary to other, those are at-home measurements that you can take and get a lot of information about your health and wellness.
Yes.
All right, thanks. Happy Friday.
Happy Friday.